So today I'm going to talk a little bit about the difference between physical therapy and chiropractic care. We get these questions all the time in our office, and one of the big things that I do tell patients is that when you find someone that's really good, doesn't matter what their background is, you want to stick with them, whether they're a PT or a chiropractor. But there's a big differences between physical therapy and chiropractic care, and hopefully this video will help you understand the difference to know, ooh, I need to go and do this because I'm going to get better lasting solutions. So my name is Stephanie. I'm with Empower Physical Therapy, and we help clients every day avoid surgery, injections, and medications while getting their life back. We want to give hope that it's possible that you can get back to doing the things that you love, because our body has an amazing ability to heal if we give it the right environment and if you have someone that understands how to put the pieces of the puzzle together. So make sure you subscribe to our channel as we provide content all the time to help you make a better educated decision on your health, on what to do. So let's go into some of the big differences between physical therapy and chiropractor. I would say our office is very different from physical therapy because we probably blend a little bit the best of both worlds, essentially. But what happens and what we hear all the time from people that come in to see us, they've been to a chiropractor and it didn't work. And so let's go into a little bit about why that is the case. So most of the time, when you go to a chiropractor, they don't have to have a prescription from a medical provider in order to go see them. So they see a lot of people that are in that acute phase. Very easy to figure out the acute phase to get people feeling better quicker in that phase. So they see a lot of people like that, and it can work. Just like if a physical therapy saw someone that was in a very acute, it just started happening, a lot of times those can be fairly easy to fix. But what happens is that physical therapy gets people that are very chronic. So we get people that have tried a lot of different things. By the time they get to see us, we're almost kind of their last resort because they are going from doctor to doctor, and here's an injection and here's a pill, and okay, we'll give physical therapy a try, last ditch effort before going to surgery. So we see a lot of chronic patients, and when we see patients that have been in this chronic pain, there's a lot of layers to it, and you've got to have someone that can spend time to figure out what those layers are. We say all the time in our office, where the side of the pain is often not where the source of the problem is coming from. And you can have pain in the back that comes from the thoracic spine. You can have it come from the hip. It can be a combination of multiple things. But when you go and you're only focusing on this one little area, that's a problem. And that's not only a problem in physical therapy, it's also a problem in chiropractic, because we get trained to only look at where the side of the pain is located. But when you have someone that is very chronic, a lot of times the chiros don't have time to figure those out. The chiropractors don't. They want to pop and go. But we find people literally say the chiropractor couldn't even get a manipulation. And I'm like, that's because your joint is so stiff and you can't manipulate it. You've got to stretch that joint. And so a lot of things that we do in our office is doing some joint stretches, or teaching people how to do some of these joint stretches to start getting some mobility. And then we hear people that have come in and see us and they go back to a chiropractor, oh yeah, they were able to get a manipulation now. I'm like, yep, that's because the joint actually moves. We also hear people go to chiropractors much less often after coming through our office because of the next reason. As a physical therapist, we are teaching you and guiding you what you need to do. And so when you go into chiropractor's office, it's like pop and go here, we're going to do everything for you, and then off you go. There's no education as to what you can do, how you can maintain it. So when we go in, because anyone that hears us speak, we always talk about mobility first. We've got to get the mobility piece down, because if you can't physically move, you're just going to be going around it. Very different than what other PTs look at. That's not a lot of their process. They go straight into strength. You can't do it. You've got to look at mobility first. And so once we kind of know what is not moving and which direction we need to go into, then we can basically teach you, once we do some manual work, we can teach you what you need to do and how you can maintain it. So we're literally guiding them through the process. You go into a chiropractor, it's pop and go. There's no education. There's education, but there's no education on what you can do. So that's another big difference. And so the other thing that you have to be careful with, especially if you're in that acute phase and there's a lot of like inflammation, and in that acute phase, you don't want someone manipulating you when you've done that. So like some of the things that we do, like especially when people are very sensitive, they come in and they're super acute, we don't even touch you, because we know if we do, we can flare you up. I can't imagine a high velocity manipulation on someone that is in more of that acute, even subacute phase, because you can really flare some people up. So we have to be very careful. So but depending on the phase of your care, we'll know how much we can crank on you versus how much we can't, based on like what phase of the care, that based on your tissue. If you're in that acute phase, we really won't even touch you. We'll just go in and start finding positions and postures and seeing if we can make some adjustments there, see how your body responds to that before we even put our hands on you. So it's very safe with our process and how we do things here. The other thing that's very different is the education on lifestyle. Now, this is true for PT and chiropractic. Now, what do I mean by that? Most of the time, people come into the office, they're like, I'm not sure what I did. I have no clue. I just started hurting one day. I bent over and, my back seized up. I wasn't even holding any kind of weight. This is very common, and we see this all the time. And what happens is that repetitions of your lifestyle, of the things that you're doing daily, accumulate over time till eventually you just do one wrong move, you step the wrong way, and it's like, that really hurts. It's not from a fall or it can be from lifting and other things. It can definitely be from those things. But the majority of the time, 80% of the time, it's I'm not sure what I did. And that's because it's your lifestyle. And it's so important to understand what you are doing every single day, because if we don't fix that, then it's just going to come back again. And this is why, we see one surgery leads into another surgery, which leads into another surgery, because you have the surgery, you fix the area that's irritated, but you're not fixing why it got irritated. And if you go back into doing the same postures and positions and movement patterns and those kind of things again, you're going to have the same problem again. And then they're like, yep, we need to go and have another surgery. So lifestyle is really big. Understanding what you are doing and what you need to do to offset what you're doing. Sometimes there's no, you have to sit for work. So we've got to make some adjustments on how you work and what you can do to combat the sitting if that's giving you a lot of problems. So that's another big thing that we look at. That you're also not going to really get with chiropractors, but I would even say physical therapy as well. It's just another thing that makes us a little bit different as far as our office and what we look at and how we provide education. Now, the last thing is, our phases of care is we do mobility first, then we get into stability. Because if you can't move, again, you're going to be moving around. There's going to be muscles that aren't able to fire. You're going to have some muscles that are in protection. And so we need to fix that first, and then we need to get into the stability so that we can get everything around those joints feeling a lot better, so that you feel a lot better and that you're able to do more and maintain it without having any kind of pain. This is another thing that a chiropractor usually won't do. It's not their sweet spot. It's not looking at their movement habits and putting in like, okay, you're weak here, you're overworking here, so now we need to make this a little bit stronger, and then now functionally we need to put it all together so we can get all of these muscles working together and not only having part of the muscles working and the other parts not. And so we really work on that stability and that functional stability to getting people back to feeling great. One of the things that chiropractors don't always do. Some of them do, but the majority don't. A lot of times it's like, let's just manipulate you. Let's put you on a machine. Great. You're doing awesome. Let's have have you, leave and then kind of come back again, where we really want to provide you education so that you know how to take care of your body. Now, there are people that just don't have time, don't want to do it. They're going to come in so that we can do the work for them so they can continue to feel good. Happens all the time. We see people like that as well, just like the chiropractors do. And we're able to do things a little bit different. And with our manual work compared to chiropractors, we find that when we can do joint stretches and we can teach you how to do joint stretches multiple times throughout the day, it has the same effect as manipulation, but it helps put you in control. And so it just gives us a reminder to tell you guys, okay, yes, now make sure you get back to doing this because it's going to help you feel good and maintain everything. But obviously if they forget, they don't do it, life gets busy, we see this all the time, then you're more than happy to come in and we can help you feel your best with some of our programs that we have that where you can come in a little bit more regular, whether it's once a month, once every other week, once a week, whatever the case may be. We have everything that kind of fits in with your lifestyle and how you want to feel. So make sure, again, you subscribe to our channel because we're putting out a ton of content, just trying to provide education to link the pieces of the puzzle together for you to help you navigate your body better. And if you have any questions or comments, make sure you comment below, and we always have more resources in the description for you to continue your learning, as well as some other free resources that you can tap into to help guide you to understanding your body better.